Hey,
You too.
Doctor, good morning. Okay, you have the floor now.
Thank you very much. Good morning, viewers, and welcome to another edition of Kakaki Cancer Awareness with Dr. Denise Eju. I have lost my voice. Can you believe that? I lost my voice overnight. I hope you can hear me very well, and I'm sure you can.
I hear you.
Morning, guests. Can you hear me?
We hear you well.
Awesome.
Well, yes.
That's all that matters. So let's go. I want to thank you all for joining us this morning. And this is in partnership with AIT. Together we fight, together we win. Thank you all for championing this cause with us. What are we going to be talking about today? The role of patent licensing. The role patent licensing plays in access to medicine across low, middle income countries like Nigeria. So for those of you who didn't know what that was, that's what it is. 4th of February is World Cancer Day. So as I'm about to start, I want to welcome our guests. Dozier, Mr. Engineer Dozier, good morning. Are you okay with me calling you Dozier?
I'm very fine. Very fine, doctor. Very fine.
Good morning. And Esteban, good morning. Are you okay with me calling you Esteban?
Definitely. Thank you, Denise. Yes.
Awesome. Thank you all for joining me this morning, and thank you as we talk about World Cancer Day and the role of patents. So World Cancer Day is the 4th of February, and firstly, I would like to ask the Nigerian government on behalf of cancer patients and the cancer community across the world to sign the Call to Action 2024. I'm asking, we are calling on governments, organizations across Nigeria to please sign the call to action because of the benefits it has. So together this year, we are challenging those in power. That's what the theme is for 2024. And literally, the campaign is all about bringing attention to the high levels across the country. Patents are one thing that are very interesting, and I've learned a lot about it. So let's start the conversation because we don't want to spend a lot of time talking about everything else. The World Cancer Day, Closing the Care Gap, United Against Cancer, those are our hashtags across the country. Where you see them, you know we're talking about cancer. And we're going to be introducing our guests. So I'm introducing my first guest, Esteban Buron. Is that correct, Esteban? I'm so used to calling you Esteban.
Yes, the name Esteban Burrone. It's a Spanish name because I'm from Argentina. Thank you, Denise.
Oh, gosh. Okay, now I get it. See? Sometimes you talk to people and you never ask that question. Who is the head of policy strategy and market access of the medicine patent pool? An institution he continues or contributes to setting up in 2010. And it promotes access to affordable health products in low middle income countries like Nigeria. At MPP, Esteban leads on strategy development and on developing partnerships with organizations and stakeholders to support access to health products. He brings to the table over 20 years of experience working in the field of access to health technologies. Welcome, Esteban, and thank you for joining me this morning.
Thank you for having me with you today, Denise.
And next, I have Engineer Dozier, and now I am not even going to attempt to pronounce this. You are going to do it for me. Dozier, please pronounce your surname, please. I will not do it. I don't want to spoil. Go on.
You should have tried, but however, let me
try. Let me try. So long as you won't take offense, I will try. Akwarofandu.
Okay, that's fine. I'm Dozier Akwarandu.
Akwarandu. Awesome. Okay. And he's the founder of Nest of Hope Advocacy and Support Community. He's a civil engineer, and he was diagnosed with stage 3 colon cancer. He's had colon cancers resection and anastomosis. I don't know.
Yes.
I got it?
Yeah.
Okay. I'm not very good with all this tongue twisting medical names. I'm not good at
Cutting to the end of the tube. You know,
He found
cutting to the tube and bringing it back, just like a colostomy.
okay. He founded Nest of Hope Advocacy and Support Community to raise awareness and advocate for cancer survivorship. He has a deep understanding of gratitude and living a rich and fulfilled life without regrets. Thank you both for joining me, and thank you, viewers, once again for joining us this morning as we start the conversation on World Cancer Day in Kakaki. Well done. So thank you both. Let's join. Let's start the conversation. Together we fight. Together we win. It's another day.
Sure.
I'm starting very quickly so that we can have a bit of time to really talk. Esteban, I'm starting with you, and I've chosen to do this because it's important that we all understand and put things in context of what is the MPP, that's the medicine patent pool, and what do you bring, what do you do, what does MPP do?
Well, thank you, Denise, for that, and real pleasure to be here in the run-up to the World Cancer Day, and of course a really important moment for everybody to come together and think about what we can do more and better in this fight. Really, I think some of the data that has come out last couple of days from the World Health Organization is quite alarming. Cancer cases increasing massively. We expect over 75% new cases, increase in new cases by 2050. So that's really the trajectory we're on. Now, what is the medicines pattern? We'll come into your question. What is MPP and what are we trying to do? Essentially, our core mandate, what we're trying to do is to facilitate access to new medicines in low and middle income countries like Nigeria. We're a public health organization. And what does this mean? Essentially, what it means is that when new medicines, as you know, are regularly being developed, cancer is an area that, fortunately, the pharmaceutical industry invests quite heavily in developing new medicines and providing hope to millions of people around the world through treatments, some of which can be real breakthroughs, and it could impact a lot of people's lives and really improve the standard of care. But in order for that to happen, of course, they need to be accessible and they need to reach the people who need those medicines. And typically what we have seen is that in many cases, these new medicines get developed and take many years before they become available in low and middle income countries. And at times when they do become available, their price is just unaffordable, either to the governments, when governments are able to pay, to the insurance systems, or to the individuals. And that really means that a lot of people are unable to access the medicines they need and may have to rely on medicines that may not provide the benefits or may have quite drastic side effects, etc. And so the idea is that this doesn't need to be that way, that there are ways to ensure that new medicines come a lot faster to LMICs, to low and middle income countries. And the way we do that is through something that's called patent licensing. And that's the theme that you had in the title for this session. And I'm happy to speak to that if you think that could be interesting for our listeners. Thank you.
Oh, yes, I think it will be very interesting now that you've put that in. And yes, it is actually one of the key things we need to understand, the patent licensing. And thank you for explaining what MPP does and what MPP stands for. So please, can you now explain what patents licensing are and how licensing can be beneficial to low and middle income countries like Nigeria?
Sure, thank you, Denise. Well, so let's take a case, when a pharmaceutical company develops a new medicine, it's typically the pharmaceutical industry that invests heavily in developing new medicines. And once they develop a medicine, what happens is they get patents. What does that mean? It means that they are essentially provided by the governments around the world. They're provided for a period of exclusivity for 20 years. What does that mean? What that means is that during that period of exclusivity, that company that has developed the product, so that innovator, is the only one that can supply that product. And now what we know is that when when you only have one manufacturer for a product, that could be any product, but applies also to pharmaceuticals, prices typically remain high. You don't have that competition, that dynamic competition that contributes to bringing the price down. So it may be also that that the company has developed the product may not be prioritizing Nigeria, has other countries that see it as its primary markets, and therefore what happens is that patients that may be needing this new drug cannot access it in your country, Nigeria in this case. So what we do is we approach the company, the innovator, the pharmaceutical company that has developed that product and that has a patent on it, and we seek a license. What is a license? What a license is essentially an authorization for more affordable generic versions of that product to be made to supply low and middle income countries. So we all know that pharmaceutical industry has focuses significantly on a number of countries which are their key commercial countries, where they make the vast majority of their profit and where they are supplying these new medicines. What we're saying is we can find a way to ensure that countries in our regions of the world, I speak for my region, Latin America, I speak for Africa, Nigeria, also get access sooner and more affordable to these products. And I guess the key question that your listeners would ask would be, well, that all sounds very nice in theory, but does it work, right? And I think that's what's interesting about this, that it does work, and it has been working. And we set up this mechanism, Medicines Patent Pool, here in Geneva, Switzerland, in close collaboration with the World Health Organization and other key public health organizations, and very closely with patient groups, with community groups that are ultimately those who need access to the medicines, but also with governments. And we set this up 15 years ago, initially working in other disease areas, started with HIV, gradually expanded to other areas like hepatitis B, hepatitis C, COVID-19, etc. And already to date, about 22 million people have had access to more affordable medicines. So it is not just a dream. It is not just a good idea in theory. It's actually something that has been working well, particularly in disease areas like HIV, and millions of Nigerians have had access to the most recent treatments for HIV. Today, the treatments widely being used for HIV in Nigeria are not any different from those being used in Europe or in the US. And so this is something that I think is possible. And of course, now as we try to break into the cancer space and really work together with yourselves and also governments and World Health Organization and many other partners to try and do something similar. Thank you.
Thank you, Esteban. Thank you for actually helping me to put the background to why this conversation is being held at this point. But in the same conversation now, Dozie, I'm going to ask you some questions, and I'm coming to you because when we listen to the role of patents and we listen to the licensing and what it's all about, then we now come to, I want you to first, as a cancer patient, this is World Cancer Day, and there's no point having this conversation without having someone who is in the disease saying something about your story. So can you give us your story, please? Share your story, please.
Yeah, well, thank you, and thank you to everyone. Like the journey has been a slopey, bumpy one, but not without the good side. So I was diagnosed of colon cancer at the age of 39. And it's important that I mention this age because it goes further to put out there that there is no status recognition. and end of the day, it wasn't really noticed until late 2019 or 2020. So I had a surgery. The story is actually long, but let me just see how I can pierce it, dissect the stuff. So the end of the day, it was diagnosed stage 3 colon cancer. Then went through chemotherapy, had surgery, the tumor was removed, and all things like that. So, but I want to thank you especially again for this timely maybe interview, because as Estefan was talking, I noticed, I said, possibly I've benefited from this MPP without knowing. In 2020, the drug I was to use was 1,570,000. That was the drug that was my plan. But when I looked at it, I said I couldn't afford that. I was given an option of a branded, same quality or same drug, but a generic one. So there was a branded one and a generic one of it, which sold for 675,000 then. So I was using the 675,000. So as he was explaining this, now my mind went back to the branded and generic model of those drugs. So if I didn't have option of using that generic one, possibly I wouldn't have gone through that treatment. So imagine when I will be doing a 3-weekly drug for almost 1.6 million. Then we've not talked about the test and the routine this thing you do before the chemotherapy section, right? So I think it's important that I mention this. So thank you so much about that. So that's my little story about colon cancer.
I actually didn't know this, and I'm actually very happy to have had somebody who has tried Epitent. So awesome. I think Esteban and I will agree that this is quite nice to have somebody who understands the concept of using a patented drug. I'm not sure if it will be MPP's drug, but let's keep going. He will tell us if it is. I'm sure he will. So from the explanations given so far on both sides now, because now it's looking interesting. Can you, Esteban, please educate us on what access to medicine now is and how does it benefit low middle income countries? Now you see, I just said it just flowed through based on where you ended, Dozier.
Well, thank you, Denise. And really, what I think a key, what we're speaking about here when we're talking about access to medicines, what we're really talking about is that the medicines need to be available, that they need to be accessible, that they need to be affordable, because it's all very nice to have it in the hospital, in the pharmacy, but if we cannot pay for it, and coming back to Dozie's story, thank you so much for sharing that with us. Affordability is really a key point. And quality, you mentioned that, Dozie, in your intervention. We really need to make sure that we cannot compromise on quality. So the fact that it needs to be more affordable doesn't mean that we need to cut corners on quality. So quality needs to remain at the center. We need to make sure that the drugs become available. And of course, the regulatory authorities in each country have responsibility for that. And that's something that we also monitor very closely from our side. And just to put that into perspective, there is the medicines, the importance of having access to the medicines that you need. But as Dozie was explaining very eloquently, it is not just about the drug. It is not just about the medicine. And how does that fit into a broader access to treatment and care that includes medicines in many cases, but not necessarily just that. And of course, having the diagnosis is critical, and that, as we know, in many of our countries can take a long time, and we often are diagnosed too late in the game or later, making it more difficult to treat. Also, the importance of access to surgery. Surgery is a critical part of cancer treatment and care, and in some cases absolutely essential, and the medicines on their own will not suffice. And I could carry on, radiotherapy, etc. So it really is a package of services that are particularly important in cancer, where medicines can be a critical component of that. And to clarify this, it is not the MPP, so my organization, that actually makes the drugs. What we do is we make sure that more affordable versions become available. We work with generic manufacturers, quality assured generic manufacturers, who would bring those medicines to market. Now, in the case that Dozy just mentioned, we're just getting into the cancer space right now. We only have one license so far on a medicine for chronic myeloid leukemia, which is a leukemia that affects many people around the world. I don't think it's not a colon cancer medicine, so it wouldn't have been through us that it's been possible for you to get a more affordable treatment. But it is a reality that what happens is once those new medicines are developed and those 20 years of exclusivity expire, generics would typically come in, and you would start seeing the dynamic, the price reductions that you mentioned. What we try to do is accelerate that, make it happen sooner. Let's not wait those 20 years. Let's try and get them in sooner so that people can have access. And we do this in collaboration with the pharmaceutical industry. We work with the innovators and we work with the generic manufacturers to try and make this happen. Over to you, Denise.
Thank you. Thank you. I'm going to ask you, Dozie, a question now. Based on what we're hearing, from your understanding of patents, and as a survivor, looking at it as a survivor, because we're all survivors, how or what do you think Nigeria needs to do to ensure we all have access to cancer treatment?
Actually, the only truth about this thing is participation. Like what Esteban said, which I really appreciate, is the fact that they are willing to do all those things. Like the thing I mentioned, I'm aware that the thing just brought to me is the concept of that patency, giving people the option for affordability. Now, I think the government needs to key into this. Truly, like all these prescription drugs, cancer drugs especially, are very expensive, right? Like the branded ones are very expensive. Now, even with these patents, like I mentioned, it's something that should have been spending like 2 million, and I'm spending like about 700,000-800,000 as a package, right, for a section of treatment. Now, how many persons can afford that? I think the only thing we need to see here is for the government of Nigeria to come into this space, right, and either as a way of maybe coming in, partnering, talking to those farmers, those pharmaceuticals, right, or the people concerned who are manufacturing these drugs, to like make it accessible. I'm not even talking about affordability, because when once they bring it in, maybe this part of the conversation, Dr. Dennis, I must have to also say, anyhow, the Nigerian government can bring in this drug for people to access is what I'm interested in saying, right? I'm passionate about seeing people who, in fact, there is, when we talk about closing the cancer care gap, right, we're talking about accessibility, affordability, and things like that. So someone who is indigent, who cannot even eat, or who cannot facility, how do you even want the person to afford a drug that is not maybe in tens of naira? It's not possible. So I think that the Nigerian government needs to participate in this, make this, that is close this care gap. And again, we are talking about cancer treatment. I'm happy that the authorities or the system, people that manage health in Nigeria are health professionals. Unlike other ministries where you see maybe a lawyer managing works and things like that. These people in the health sector are aware of the burden. They are aware of the disparities in cancer treatment. And the cancer treatment is not just from the drug itself, right? So we need government participation. That is what I think, as from my own point of view, that government should do. Then if it is the patented from the description of Esteban, how the interface, right, between the manufacturers, okay, with this thing, it makes it more easier and faster for government to know the right drug, the quality drug that is available at any time, any point in time. And again, it's important to mention this. You see, with this, it will also curb the menace of fake in this sector, because a whole lot of persons are also spending money without getting value for what they are spending money on. So it's important that we key into the right source of these right drugs. Thank you.
Thank you, Dusi, thank you. I want to believe that the people who make the decisions are hearing what we are saying, and there's a lot of conversation going on around now, and I think we're talking to power now in Nigeria, and I want to say thank you for that. Esteban, I'm going to ask you to round up with your final comment. But in it, I want you to think about why it is important that this conversation has happened at this time when we're talking about closing the care gap, speaking to power.
Well, thank you, Denise. And I think it's hard to follow after what Dozie has said. Clearly, I mean, there's a very important exercise of listening that we all need to do to the patients, to the community, to the people who need the cancer treatment and care, and make sure that they are at the center of the response. Of course, my pleas for all stakeholders to work together towards this. We do this by working with the pharmaceutical industry to make them realize the importance of accelerated access to the new treatments. And I think we need, it's a plea for all companies that are working on new medicines to really think about, new medicines gets developed. It needs to become available everywhere. And it's not just developed for a few people. It needs to become available everywhere. I know it's not easy, and I know there's lots of challenges in that. We're here to work with people, and I think I can count also on both of you to work all of us together to try and make sure that we don't have, the best drugs, the best standard of care in a few countries, and then other countries are not able to access that and are struggling to access even the oldest drugs that in some cases may be very effective, in some cases may have significant side effects and may be a real challenge for some of the patients. So thank you.
I want to say a very, very big thank you to you two, gentlemen, for your time and for actually starting this conversation at this particular time of the year, where World Cancer Day is the celebration, is the discussion for 2024. So together we fight, together we win. Thank you, Esteban. Thank you, Dozie.
Thank you very much.
Follow us all on our social media handle, Common Cancer Foundation. Share, subscribe, and click on the share button. You can always find, and you will find this video sometime later today on our YouTube channel for you to be able to pick up, share, and let people know what's going on in the cancer space as we go into World Cancer Day weekend. A lot is going on across Nigeria. Please be part of it. Together, our voice matters. And if we don't talk about it, we're not going to address it. To everyone in Nigeria, we are celebrating this time. Please be part of this conversation. And we look forward to seeing you again in 2 weeks. No, next week, I think. No, in 2 weeks' time. So thank you all. Together we fight.